We're on this computer. Great. And we are live on Facebook and we're recording on the computer. So welcome, Dr. Park. Thanks for being here.
Yeah, thanks for meeting me this morning so early.
Absolutely. Yep. I think it's a great time. Hopefully we'll have some people tune in for the Facebook Live too. So welcome everybody. We're live on the New Aria page. My name is Maya. I'm the founder of New Aria and the Habit and Behavior Change curriculum and program, and heart training, of course. And we're here with Dr. Emily Park. Many of you actually know her. We work outside of Arizona or inside Arizona Wellness Medicine right now, as Kristen is one of her health coaches as well. So we're here to chat about autoimmune diseases today. And it's a term that Dr. Park specializes in, but it's a term that gets thrown around a lot. So can we dive in and dissect this, Dr. Emily? What is autoimmune diseases? What are they?
Yeah, sure. So, the term autoimmune diseases, it's a broad category, and it's kind of like an umbrella for a lot of different diagnoses. So the general term autoimmune disease means your body's own immune system sees something in your body that's normally normal, like an organ or a tissue, and it starts attacking it. So your body's immune system creates antibodies, so against a foreign invader, normally. Like that's how it works when you get sick. Your immune system gets called to action and it creates antibodies, and then it cures your infection or allergy or whatever it is that your immune system's responding to. But in the case of autoimmune disease, the signaling kind of gets a little bit messed up, and what happens is your body's own immune system starts attacking itself. Yeah, so that's like the general description.
Got it. So I guess the next natural question that just wants to flow out of me at this point is, now, of course, that's why you exist, but why?
Yeah.
Why did that even happen?
Right. So there are multiple different reasons why someone would get an autoimmune disease. There are some genetic predispositions, and there are some actual genes associated with some of the autoimmune diseases. For example, celiac disease is an autoimmune disease of the small intestine that occurs from eating gluten. Well, then we know there are definite celiac genes, HLA-DQ2, HLA-DQ8, but not every autoimmune disease has an exact gene, but sometimes we know it runs in families. So that's one thing, is to have the genetic predisposition for an autoimmune disease. But a lot of people have the genes and or disposition to genetic or pre-genetic disposition to autoimmune diseases, but they don't ever get the autoimmune disease. So the big point here is that there's got to be a trigger, or more commonly triggers, that turn on the autoimmune disease being expressed, meaning turn it on in your body. And these are all, there's many different factors that lead up to that. So this is how the environment interacts with your genes to then create a disease process itself. So to give you an example of those triggers, that's probably what you're going to ask me next, right?
Yeah. My brain's going straight to stress.
Yes. Okay. So exactly. Okay. So that's one of the big triggers. And I have seen in my patient population, just stress by itself create an autoimmune disease, flare. Basically, if everything is going really well, just stress by itself can create a flare. Now, other huge factors are nutrition. And this is one of the reasons why, I'm such a big, supporter and proponent of doing paleo nutrition. And that's because it's an anti-inflammatory, nutrient-dense food plan that takes out most of the common food triggers too. And then there's something even a little bit more in depth that takes out more foods when you have severe autoimmune disease, called paleo autoimmune protocol. But so you've got stress, you've got nutrition, you've got nutrient deficiencies, you've got toxins, you've got chronic infections. And so those are kind of like big, broad categories as far as things that can turn on or trigger autoimmune disease from happen. And the term stress is a big general term, right? Like, so to me, stress, well, everyone thinks of stress as, mental, emotional stresses, which is 100% true. But the term stress is really a term for, all the things coming at your body, mental, emotional, physical, just like I said, that there's, if you're not sleeping well, if you've got toxin overload, chronic infections, if you're, working out too much, there are so many different factors that are, create the total load of stress on the body that then, can, flip on and trigger an autoimmune disease.
Okay, okay, perfect. This is good. What I'm going to recap, and for everybody who just tuned in, by the way, I see a bunch of people coming watching, starting to watch. So this is Dr. Emily Park. We're talking about autoimmune diseases today. What are they? What triggers them? And then obviously how they're impacting your life and how to start moving forward. So if you have any questions on anything, please just put them in the comment section and we'll be sure to answer them. So, okay, Dr. Park, what, we talked about the triggers there for a minute, but back up for just a second. So we say autoimmune diseases, and what are types of autoimmune diseases?
Cool. Okay. Yeah. So, so I mentioned one earlier, celiac disease, right, is an autoimmune disease of the small intestine that gets triggered by eating gluten if you have, certain genetic predisposition. So there's autoimmune diseases of the gut. So there's celiac disease. Then there's also Crohn's disease and ulcerative colitis, right? Those are kind of like the three, autoimmune gut disorders, the top ones that you think of. But then there's other autoimmune diseases like rheumatoid arthritis. That's, related to the joints, right? Having joint deformations and joint pains and muscle aches. And then there's, a category of, other musculoskeletal disorders like lupus, mixed connective tissue disorders, scleroderma. There's a big list of autoimmune diseases in that category. I'm not going to name them all. But then there's other central neurological autoimmune diseases like multiple sclerosis is a big one, of course. And then the one I see the most, which is the most common autoimmune disease in my practice and probably in most people's practices, is Hashimoto's thyroiditis. And so that is, and I know, you and I did a good interview session about thyroid disorders and Hashimoto's before, but that's a very, very common cause of hypothyroidism. But you can also have the opposite. You can have Graves' disease, which causes hyperthyroidism and overactive thyroid. So, I didn't name every single autoimmune disease under the sun, but those are kind of the most common ones that are out there.
Yes, it's autoimmune tends to be this. You work with this every day. I tend to be kind of more on the outside, just from the habit, behavior change, nutrition perspective. But it's a wide open space. It seems as though that patients that we've seen with autoimmune diseases and disorders, it's almost, there's a level of, what's the word I'm looking for? It's kind of almost helplessness. Like I've tried every route and I don't know what to do. So in your opinion, of course, and I have my own opinion that it is actually healable, so to speak. So talk to me about the trajectory. People don't really have to live with this, right?
Yeah, totally. So on the traditional side of medicine, so and again, I'm doing functional medicine, right? So I'm getting a lot of the patients that went the traditional route and either didn't get any better or want to get off the medications or had side effects from medications and can't take them anymore. So I'm getting the patient population that is looking for something different. And of course, functional medicine is all about finding and treating the root causes of whatever signs and symptoms are going on. So in the case of autoimmune disease, this is no different. Just like I talked about at the beginning, our job in functional medicine is to really figure out what all those triggers are, so that we can start reversing each of those things that turned on the autoimmune disease in the first place. So autoimmune disease is largely reversible. And I say the term reversible because, there's two things. So one, reversible means that if we can make you feel a lot better, and we can reverse a lot of the changes that have happened. But the term reversible is and not curable is on purpose, because if you go back to doing what you were doing to trigger your autoimmune disease, it will come back, right?
I see. So is this, okay, that makes sense. So there's the triggers, of course, with the genetic predisposition, and if the triggers are turned on, so to speak, and as we mentioned, the triggers: stress, nutrition, nutrient deficiency, toxins, chronic infections, that kind of stuff. So if we go back to any of those triggers, so this is something that potentially it's kind of in the background, but a life cleanup is required.
Absolutely. Now, in certain autoimmune diseases, if they've been going on a long time, like for example, if someone's had rheumatoid arthritis for 20 years, they're going to come to me with joint deformities that aren't going to really be reversible, right? Because the joints have already been destroyed. Or if someone's had Hashimoto's thyroiditis for 30 years, they might not have much of a thyroid gland left because it's been destroyed, but we certainly can still get people feeling a whole heck of a lot better because by decreasing those circulating antibodies. When those antibodies are floating around, it's not just about the thyroid or the joints. There's symptoms of all kinds all over the body, and so people really do feel a whole heck of a lot better once you find and treat all of those root causes.
Back to the root causes, completely agree. I'm getting the full picture here. So for those of you who just tuned in or are watching, this is Dr. Emily Park of Arizona Wellness Medicine. And so Dr. Park, we work very closely with Dr. Park because there's in habit behavior change, of course, as you know, we have to have a plan to move forward. And then there's the implementation of that plan and the long-term habit and behavior change. Because most of us know what to do. It's just a matter of actually doing it. And when we're in the face of chronic disease, when we're in the face of autoimmune diseases, these things quite literally have to be followed. And if we're met with any resistance in our lives to actually following it, we're not going to get the health that we're looking for. So the point of that question was, Dr. Park, tell us what is the difference, you touched on this, of course, but what's the difference then between, say, a regular medical doctor versus you practicing functional medicine?
Sure. So, I did, go to traditional medical school, internship, residency, fellowship. So I'm fully trained on the traditional side. And then, of course, I got trained and certified in functional medicine. And so the difference is in traditional training, and again, I did it all, so I very well know it. They really teach us what drug do we have, what procedure do we have to treat the signs and symptoms that patients have. Really the thought process on, finding and treating all of the root causes, getting to the bottom of the why is unfortunately largely missing from our medical education. Like the importance of nutrition, sleep, exercise and movement, stress management is really missing from traditional, medical school. Like, of course, there's a mention of nutrition, like, oh, if you're overweight, hey, you should probably cut your calories, or, oh, if you have type 2 diabetes, cut down on your sugars and carbs. It's almost like a side note instead of like the main event, which it should be, because nutrition, sleep, exercise and movement, stress management are the foundations to health. So that's key in central and functional medicine. And then other concepts that are make us a little bit different in functional medicine are that, we tend to have a lot longer visits, new patient appointments, 90 minutes with me. And we care about not just your health history in a vacuum, we care about your whole life history, because as we've talked about already, there is such a huge mind-body connection. And so we really do get to know people really well in the process of functional medicine. And then of course there's the advanced laboratory testing that again, is kind of missing from, traditional medical school. And we also look at things through the lens of wanting to get to optimal health or optimal ranges, not normal. So if you do a traditional blood work panel, from your primary care doctor, first of all, they're only going to check probably a handful of things. And again, it's not their fault. Like I went to regular medical school too. It's how we were trained. And if everything looks normal, you'll be told exactly that. Everything looks normal. Well, in functional medicine, we look at normal versus optimal, where you are in that range, how it's affecting your health, and what we're going to do about it.
Yes, absolutely. And I want to, which by the way, for those of you watching, just stay tuned, hold on for just a second, because I want to go into Dr. Park's generalized recommendations for autoimmune diseases. But there's something that I want to mention first, and it's very important, is I want you to think about this differently. Here's how I want you to think about this kind of medicine, is that it's not supplemental. And it is not, I don't know, woo-woo, so to speak. It's not like, this is the next era of medicine, and this is how you must think about it, is that functional medicine is moving into a place where we are looking at the root causes. And I'd go as far as to say, us here at Nuaria, we're the next era of nutrition, because we know what to do. So it's going to be very important that if autoimmune disease is something that you've lived with for a long time, that you don't have to live with it. This is one of the reasons that we've partnered with Dr. Park on a really exclusive level. So Kristen, our dietitian, Kristen, she is inside Arizona Wellness Medicine as the health coach there as well. And so what happens is when you go see Dr. Park, she's going to give you that recommendation, and you combine health coaching sessions with functional medicine. That's your first step. And then you can go through the protocols and get done what needs to get done. And we help you through that with food suggestions and meal suggestions. And then you move into habit and behavior change naturally, because we need that piece where it says, I know what to do and I'm feeling better. I've reduced these autoimmune triggers in my life. Now, how do I actually maintain it?
Yes.
Meaning that something important will happen, and that's called life. It's called stress, anxiety, falling off the wagon, mother-in-law, Saturday nights. Like, these things are just going to happen. And if we don't learn how to think differently, change the all or nothing thinking, perfectionist thinking, trying to control things in the future that we can't control, that ultimately drives behavior. That's what we do at Habit Behavior Change. That's why this whole combination is not it is the next era of medicine, because this is what's going to get you back to that happy and healthy and whole you that's truly the truth of who you are. So, all right, Dr. Park, let's talk about so autoimmune diseases. We talked about what they are and the triggers and kind of what types, and we know that it is reversible and we have to reduce those triggers. So kind of like a blanket statement with autoimmune, and I know that this is a big one, but what would some generalized recommendations be?
Sure. So I want to actually back up to something you
okay.
Okay. Awesome. No, this is great. So for those of you, if you've never heard the term functional medicine, so I have my training and certification through the Institute for Functional Medicine. And back in 2014, the Institute for Functional Medicine paired with the Cleveland Clinic. And there's been the Cleveland Clinic Center for Functional Medicine since 2014. And they are there. Institute for Functional Medicine is there comparing traditional healthcare costs and outcomes to functional medicine healthcare costs and outcomes, and the preliminary data on it so far has been really amazing. So, to your point of, this is the next era of medicine, and that center at the Cleveland Clinic Center for Functional Medicine, it just keeps booming and growing. Like, they keep having to grow out of their space and get a new, bigger one. There's an over 2,000 patient wait list there now. And then in the functional medicine training, everything was very evidence-based, very research-based. There's, a reference for the research behind everything they're saying on every single slide of every lecture. So to your point, it is, so it's two things. It's the modern medicine, right? Mm-hmm. But it really it's the modern medicine in the fact that we're kind of ahead of the research curve a little bit. It takes on average 15 to 20 years from the time something comes out in research, before it's truly implemented as, standard of care. So that's one thing. But then I also feel like functional medicine is kind of like the old medicine. It's what medicine used to be. Like, your doctor used to know you. They used to come to your house. They knew your family and everything about you. So it's kind of like that, combination of the two things there. So I hope that helps.
I love that. It's medicine and then ahead of the curve to create that new standard of care. And I think you and I are on the same page with this, and we've had the discussions. But
totally,
in order for our world to move forward, because we've got more obesity, heart disease, and diabetes than we've ever had before, more stress-related, habit-related diseases than we've ever had before, and something new is needed. Like, we need to change the trajectory of medicine. It's happening now, but it's extremely important that we start seeing it that way.
Yes. And then the other thing I wanted to talk about briefly was because you perfectly mentioned about the habit and behavior change, right? And so I see exactly what you described in my practice all the time. So in my autoimmune disease patients, there's a category of people that, I can give them their, entire roadmap to health, their plan with nutrition, sleep, exercise, stress management, their nutritional supplements, what they're supposed to do. Everything's very personalized, right? And there's a certain, a small percentage of people that can take that and go with it, and they're good, right? But that's the smaller percentage. I would say the larger percentage are in two categories. They're in either the category of they really never are able to fully implement the plan, or what I see a lot is people implement their plan and they're feeling better for a few weeks, a few months, a few years, and then just exactly what you said, life happens, stress happens, and then XYZ part of their plan starts falling apart, and then then their disease starts to regress. And depending on what kind of autoimmune disease you have, I'm going to give you a perfect example. One of my MS patients describes it beautifully. It's like, whether she sticks to her nutrition plan or not makes the difference to whether she needs a wheelchair or not. I mean, it's that profound. Yeah. Wow. So, this is a big deal. And, one of the reasons I love working with you guys at New Aria with habit and behavior changes, people also have to learn that they don't have to be 100% perfect 100% of the time, right? Like, it doesn't have to be stressful.
Right.
Right. And one thing you guys do beautifully is you get patients' health habits on the same level as, you know, other habits that people do on a daily basis, like brushing their teeth or tying their shoes, as as you've mentioned as examples before. And so it's getting those health habits onto a level where it's not a stress. It's not like, oh my God, I gotta meditate today, or it's just happening.
Right.
You know? So that's just so important for the longevity, you know, especially if an autoimmune disease patient, but lots of other diseases apply to that category too.
Huge. Completely agree. Yeah, it's really a matter of, it's definitely a life change for sure. And so we work with in the beginning, basic habit loops when we go to change the physical habits and behaviors. There's cues, routines, and rewards. And the human mind, the human brain is wired to always choose pleasure over pain. And simply that means that we choose the less painful option at all times. And so it's not right off the bat that someone says, I mean, even in that wheelchair example, sometimes we choose the food if it is some kind of form of pleasure, more pleasure than the wheelchair. So we quite literally have to start shifting, and it shifts to become this effortless choice. It's easy and effortless for me to not reach for sugar because I feel better and have found more pleasure in the not having of it than the having of it. And so that shift has to happen. But in the beginning, we tend to fight ourselves. And that's one key point in habit behavior changes. We help you to just reduce your resistance until you get to that threshold and move over where it is easy and effortless, but only first because you've reduced your resistance. Most of us tend to use willpower unstrategically and force ourselves to the other side in the beginning. So
right. Yep. And then, you know, the beauty of, you know, combining it with functional medicine is then we've got all this wonderful data from the advanced laboratory tests. So I think, you know, patients also find it really motivating when you're like, look, your thyroid antibodies came down, you know, your thyroid function is better, or, you know, things that are very like, oh, look, I'm reaping I know I feel better, but look, my labs are better. Like they're reaping the rewards of their hard work. And so I think that is, you know, a good, nice, positive reinforcement as well. Not just, oh, hey, these are things I should do because my doctor said I need to do them to feel better. It's like, look, no, you're actually getting better.
I love it. I completely agree. And it just popped into my head. I think it's appropriate time to ask, but that's one of the reasons I love you so much. You have the same amount of passion that I do, but why do you do functional medicine? Why do you do this?
Yeah. So I did traditional medicine for years, right? So, you know, this type of medicine is really all about true healing and changing someone's long-term trajectory in life. I mean, I think your answer is exactly the same, right? You know,
yes.
You were in the traditional side, you know, of being a registered dietitian also. And I think, you know, both of us, loved our careers and everything, but there was just something missing. It really wasn't as rewarding. And I think, you know, obviously both of us have our own stories as patients, right? On the other side too, and frustrations with the traditional side. And so that's why I'm sitting, you know, in the chair I am now instead of on the traditional side. As, you know, I had my own frustrations as a patient, and I had my own frustrations as a doctor taking care of patients in the past also. And so I just knew there was something better, more, you know, permanent, so to speak, out there to really help people heal, instead of just giving out a pill for a Band-Aid, you know, or instead of you giving out, here's your food portions and here's your calories, right? Like there's a way bigger picture out there for, you know, permanent habit and behavior change and for optimal health and healing, really. And so that's kind of the gist of the why for me.
That's amazing and perfect. Yes, I love it. I wanted you to share that. Cool. For those of you who are just joining and watching, we're talking about autoimmune diseases. So my next question for Dr. Park, and then I'm going to stay tuned because I want to share with you where you want to go. If this plagues any of you in terms of celiac, gut health, Crohn's, ulcerative colitis, rheumatoid arthritis, lupus, multiple sclerosis, Hashimoto's, Graves, these are all types of autoimmune diseases. And so Dr. Park, tell us, what are generalized recommendations that you would have?
Perfect. Yes, you did ask that earlier. So there's the big categories of nutrition, sleep, exercise, and movement, stress management. So on the nutrition part, the very first recommendation is going to be to get yourself moving towards more of a paleo type food plan. And again, it's because it's anti-inflammatory, nutrient dense. It stays away from processed and packaged food items. It really just gets back to eating whole food, real food. That's very healing to the body, number one. And number two, takes away the most common food triggers that can contribute to flipping the autoimmune diseases switches on. So nutrition is paleo. And then, of course, if you have more significant autoimmune disease and or if regular paleo is not enough, you can go to the next level, which is paleo autoimmune protocol. That is a little bit more restrictive than traditional paleo. And then there's actually even a third level that was designed actually specifically for neurological and autoimmune disease like multiple sclerosis, called the Walls protocol, that gets even more restrictive. But about 80% of the time, traditional paleo works really well. So I don't have to really use any other, further restrictive food plan very often, but it definitely is out there. And I do have some patients that they needed to do a paleo AIP, autoimmune protocol, in order to really get better.
I was just going to mention that. So when you see recipes that say AIP, that's what that is.
Yes, exactly. Yes. Autoimmune protocol. So traditional paleo takes out, just as a review, it takes out the grain family. So gluten, of course, but it takes out grains of all kinds. It takes out dairy, soy, legumes, and peanuts are a legume. They're the only nut that's really not a nut, and corn is a grain. And then, of course, it takes out, it's a sugar detox, and as I mentioned too, it takes out all the processed and packaged food items. So a paleo plate is real food. Half the plate non-starchy vegetables of some kind. Then there's a serving of lean protein, a serving of healthy fats, and then, especially at dinner, a serving of either starchy veggies and or some fruit. So it's nothing, weird or odd. It's just, getting back to eating real food. So that's like, nutritionally, that's the top recommendation. Sure. Then there's other factors that are huge too. For instance, like getting enough sleep. Not getting enough good quality sleep is a huge stress on the body. And in my patient visits, we talk about all these factors every single time because it's so important. If someone has a situation where they're not getting enough good quality sleep on a regular basis, that's a big stress on the body. That'll affect the adrenals and the thyroid and the sex hormones and the immune system. And then, as you know, on the food side, it's like food cravings and not making, you're not making great choices, and it has a huge waterfall effect. So there's nutrition, sleep, and enough good quality sleep really means on average somewhere between 7 and 9 hours of sleep at night. But that number is, it varies from person to person. So you have to kind of figure it out yourself. And how you do that is it's the number of hours of sleep that you wake up and you feel pretty refreshed. Like, oh, okay. You could just, pop out of bed and do anything.
I feel human again. Yes.
I feel human again. Exactly. So there's nutrition, sleep, and then of course there's the exercise and movement part. And they are two separate categories. The movement piece really refers to that, kind of magical 10,000 steps a day that's been pretty well studied. And of course, if there's limitations in actually walking the 10,000 steps a day, there are substitutes, of course, swimming or biking, things like that. But it's getting your, daily movement in. And this is just, less sitting, more standing, more walking around. That's important. And then there's the exercise piece. The exercise piece, the current, recommendation is at least 150 minutes a week of moderate intensity exercise. And that's for, optimal cardiometabolic health. And then, with each patient, we can get even more specific on the exercise recommendations if we need to, like for brain health, it may be more, high intensity interval training, and, for diabetes, and, might be more lifting heavy weights with some high intensity interval training and so on. But honestly, the details are less important. I always tell people the best kind of exercise is the kind you'll do.
Yep, we said the same thing. Yep.
Right? It's like whatever, is motivating to you, whatever you like. If it's a Zumba class, go for it. If it's a spin class, whatever. Because, doing the exercise is more important than the details on the what. And I can prescribe you the details and for people that are at that level and can do it, great. But that just doing it is most important.
Yes. What do you have least amount of resistance to?
Yep.
Yes.
And then of course there's the big stress category that we were talking about earlier. And this is why I, really emphasize a daily relaxation practice to my patients. And, the biggest, most well-studied one is really meditation. Meditation works better than medications for many things. But it doesn't have to be meditation. It can be meditation, deep breathing, yoga, tai chi, qigong, whatever it means. For taking an Epsom salt bath with lavender oil, great. But I'm very interested in people having a daily relaxation practice, because it's super important to keep your nervous system balanced. And here's why. It's because the sympathetic nervous system is this fight or flight stressful side of the nervous system. This is, being overstressed. And then there's the parasympathetic nervous system, which is the rest, relax, digest side of the nervous system. So things like meditation help lower the sympathetic nervous system, and they raise the parasympathetic nervous system. So it very much decreases your stress hormones, which are the things that float around, like cortisol, for example, is one of your body's main stress hormones, and can have so many damaging effects on the body. We know that high cortisol does affect the immune system. It lowers your immunity, and then has effects on, like I was mentioning earlier, on other things like your thyroid hormones, your sex hormones. It can affect blood sugar balance. I mean, it really does have and it can affect body composition directly too, your cortisol levels. It will store fat and waste muscle at the expense of storing fat. So, I mean, so it's not just, I know I should relax more. I know I should meditate more. There's like true medical research and medical benefit behind the daily relaxation practice.
Huge. I've seen it and experienced it firsthand, which I think we both have.
Yep. So nutrition, sleep, exercise, and movement, stress management, those are the big, foundations to health. And that's where anyone with an autoimmune disease should start. They should start their journey there. And then, of course, if they want to get more, more specific, more in depth, then, they're going to want to find a practitioner that can do, some advanced laboratory testing on them, so that they can really dig out all of those root causes.
Yes. Perfect segue too into exactly what I want to mention. The reason that we at Nuaria have partnered with Dr. Emily Park at Arizona Wellness Medicine and Functional Medicine as well is, so we kind of, here's your trajectory, here's your 10,000 foot overview, because there was a lot of information in this. So we'll be sure to recap it all. And I'll make sure around this video some places, both Dr. Park's information and our information. So here's the trajectory and what you'd want to do. Of course, at Nuaria, we do health coaching and habit behavior change program, a curriculum, and a lot of habit-driven diseases, diabetes, obesity, heart disease, that kind of stuff. You want to be healthy in general. And so we've partnered with Dr. Park. Of course, if you have any of these autoimmune diseases that we spoke about and wish to get healthy and reverse them, yes, it is possible. And so we're looking here at the first thing that you'd want to do, of course, is schedule an appointment with Dr. Emily Park. And we've partnered with Arizona Wellness Medicine. We can include functional medicine visits with Dr. Park and health coaching together. That's the first thing you're going to want to do, just basic health coaching, because you're going to get this plan. We've got to start implementing the plan, and we can harness the power of our all or nothing, so to speak, for a little while, get us on the ball. Then you want to move into, with Arizona Medicine, with our habit behavior change. You want to move in habit behavior change program with us. That's going to help you stay on track for the long term. Something that's also incredibly important to stay on track for the long term. And I just gave a lecture at Arizona Wellness Medicine on thought and emotional habits, is that in habit behavior change, our thoughts drive our emotions, drive our behaviors. So in order for the behaviors to stay permanent, when we work the path of least resistance and our stepping stones to create habits, we want to make sure that we're actually changing the perfectionism thinking, the all or nothing thinking, catastrophic thinking, trying to control things in the future you can't control. There's something important that happens, and I say this from experience and having coached for 12 years, is that oftentimes when we feel physically bad in the body, and I'm sure you've seen this too, Dr. Park, is we can become our disease in a way that is not preferential, so to speak. Meaning that when you wake up every day and
your identity becomes your identity, and right.
Bingo. If we're waking up every day and saying, am I sick today? Yes, I'm sick today. Am I sick today? Yes, I'm sick today. You will get in that cycle. And you can feed, it's the equivalent of feeding your body Brussels sprouts, but feeding your mind and emotion candy bars. And we expect to get healthy that way. And so we've got to get a zero wobble in all of these areas. When it becomes your identity, that's a very dangerous place to be. So that's another reason that you want to tack on habit and behavior change to your functional medicine. So yeah, I love it. Anything to add here, Dr. Park? Anything you want to add?
No, I think we covered, quite a bit.
Yeah.
And yeah, like as Maya mentioned, the reason that we paired together, that I've got her in the practice integrated, is because, I can create all these awesome plans, but, the long-term follow through, or for some people, even just getting started, is a bit overwhelming. And so, health coaching, and then especially, the habit and behavior change curriculum really helps patients implement long term. And I tell people this at their visits all the time, like, it's the long game. Here are your long term goals. I don't expect you to start doing everything 100% perfectly, by the time you come for your first follow-up visit, for example. And so, really implementing the long term health changes are what are going to really help people get healthier to begin with, and then stay healthier, because as people progress in functional medicine, the goal is to get you to a point where you don't need me. You're coming in once or twice a year, and we're checking your labs, and we're staying ahead of the curve. Same thing with you guys, right? It's to get you to a point where your clients aren't going to be ingrained in a hardcore program, because eventually they've got it. Now there's going to be ways to stay plugged in, like, right? The same for ways to stay plugged in, once or twice a year, and, or, people can stay connected to you. But the goal is to get to the people to the point where they don't really, we've taught them and they know how to do it themselves, basically.
Absolutely. Absolutely. And knowing that this autoimmune disease is this is anything that has been what's the word I'm looking for? The diagnoses. Thank you. The diagnosis is not who you are. It's not an identity, and it certainly is reversible. I've found in my own life experience, it's really the difference between wanting and deciding that we're going to make a change. So I'll make sure we put all of the information here. This was such good stuff. So if you just joined us, make sure that you stop this video and go watch the whole thing, because we talked about what are autoimmune diseases. We talked about the triggers that turn them on, the types of different autoimmune diseases, how it is indeed reversible, and then Dr. Park's general recommendations. You're going to want to go through the whole video because it's super informative. And what I will do is call Dr. Park's office for Arizona Wellness Medicine to find out more information and schedule with Dr. Park. And of course, there's always a complimentary 15-minute consult with me at Nuaria to learn more about habit and behavior change as well. So we're here to help. That's the intention for both of us. So thanks everybody for watching today. We hope that this was helpful for you. Dr. Park, thanks for your time today. We totally appreciate it. It was perfect.
Thank you as well. Have a great day.
You too. Have a good weekend.